Hello, beautiful people. Welcome back to my channel Mahima's Diet Clinic. Today in this video, we'll be seeing about ulcer. Ulcers are categorized under digestive disorders. Digestive disorders are among the most common problems in healthcare. The term peptic ulcer is used to describe any localized erosion of the mucosal lining of those portions of the alimentary tract that comes in contact with gastric juice. This disintegration of tissues can also result in necrosis, that is, death of most or all of the cells in a tissue. The majority of ulcers are found in duodenum, although they also occur in the esophagus, stomach, or jejunum. Helicobacter pylori is the chief cause of ulcer. It is spiral shaped with gram-negative unipolar flagellum. It colonizes the stomach in about 50% of all humans. In developing countries, virtually everyone may be infected. Infection is typically contracted in early childhood and remain for the rest of life. Only in 1% of people does the infection leads to stomach cancer. Peptic ulcers are of two types, gastric ulcer and duodenal ulcer. Ulcer present in the lower end of the esophagus or stomach is known as gastric ulcer. It is categorized by pain in the epigastric region coming about half an hour after a meal which passes off before the next meal. Loss of appetite, discomfort and flatulence in upper part of the abdomen, fear of taking solid foods, nausea and vomiting are symptoms of gastric ulcer. Duodenal ulcer. Ulcer present in the abdomen is called duodenal ulcer. It is categorized by pain in the epigastric region coming from 3 to 4 hours after food when the stomach becomes empty. The so-called hunger pain, which wakes the patient at about 2 a.m. in the night and is almost immediately relieved by food. The pain lasts for few minutes rather than hours. Causes of peptic ulcer are excessive consumption of alcohol, excessive smoking or tobacco chewing, excessive consumption of spicy foods, pickles and condiments, etc., excessive consumption of strong tea and coffee, inadequate chewing of food. It occurs in persons who do overwork and eat food at irregular timings. Fear, anxiety, other emotional disturbance, prolonged fasting. In this condition, prolonged empty stomach may induce hypersecretion of hydrochloric acid, which is the causative factor. Next is hereditary. The aim in the dietary management of the patients with peptic ulcers are as follows: to provide the food in small amounts frequently, to provide adequate nutrition, to give rest to the stomach and intestine, to continuously neutralize the gastric acid, to inhibit the production of gastric juice, to reduce the mechanical, chemical and thermal irritants. A day's menu for peptic ulcer patients are as follows. For early morning, have warm water 200 ml and after 5 minutes include buttermilk 200 ml. For breakfast, you can include 1 katori of leftover cooked rice soaked in water overnight, 100 grams of curd, 1 small onion, 1 apple and 1 cup of pomegranate. Mid-morning should include 2 cucumbers, coconut water 500 ml, green leafy vegetable salad 1 cup. Lunch can include 1 katori of khichdi or green gram dal with white rice, or you can also include mung dal with white rice. 100 grams of curd should be included and 2 egg whites. Evening snack can include puffed rice or any other snack that does not irritate your digestive tract. You can also include barley water. Dinner should include idli and sambar or soft dosa and sambar with tender cucumbers. Bedtime can include 200 ml of saffron milk, or you can also go with plain milk. would like to share some additional tips. Whenever you feel uneasiness or burning sensation, you can go for tender cucumbers and buttermilk. Consume 50 to 100 ml of coconut milk with honey. When you go to make sambar, reduce or avoid tamarind. Use moong dal or pasi parpe instead of red gram. Those who suffer from severe ulcer can totally avoid sour and spicy food items. Instead of idli sambar, you can also go for milk rice, that is pal sadam, with salt to taste. Rice should be well cooked so that you can smash it with milk and make it semi-solid. This will give you relief from severe burning sensations and ulcer. Avoid fast food and rough food such as chapati, roti, puri, burgers and pizzas, etc. Avoid beverages such as coffee, tea and other soft drinks. Hope you liked this video. Please do follow all these tips to get rid of ulcers. See you in my next video. Until then, bye.